Good morning, everyone. So, happy Valentine's Day, first off. I wanted to do an Instagram live this morning about lip filler. Since it's Valentine's Day this month, I feel like everybody and their brother is talking about lip filler. We all want juicy lips. So, let's cover all the questions, answers, things like that I get with lip filler that's kind of involved with it. So, I've been asking patients all week, hey, give me some questions that you have. I've kind of been writing stuff down that people ask me in appointments. So, I've got a good little list going. So, let's start covering it. So, what is lip filler? Lip filler is hyaluronic acid. That's what I choose to inject in the lips, which is a naturally occurring sugar found in the body. But if I inject it, just sugar, what's going to happen? It's going to melt. It's going to go away. So this filler is hyaluronic acid, but it's cross-linked to get the longevity from it. So you can get up to about a year duration from it. With that being said, though, I have a lot of patients that have been injecting for a really long time, and they'll come back to me way over a year. I have some people 3 years, 4 years. They still have filler in there. So it lasts a lot longer than what we think. So every different type of filler, I'm super picky on my selections whenever it comes to that, because every different type of filler acts a different way in the body. There's something called rheology whenever it comes to filler. Sorry, I pulled some giveaway winners and they're sticking to me. I'll announce that after. So, this is some of my more top popular types of fillers. So, for example, this is RHA2. This is a soft, flexible, natural filler, but you can see it has some cohesivity to it, which means it allows it to stick to each other. So it allows me to sculpt the lip and shape it. So if we have some difficulties in areas like an M-shaped lip where it's heavy in the middle and then hollow on the sides, it allows me to even that out and bridge the gap. I think yesterday, I believe it was, that I actually posted a picture of lip filler with an M-shaped lip. So you can go back and look at that in our regular news feed. We also have things like Versa and Lips Plus, which is another filler, but it just acts a little bit differently. You can see that it's a little more stretchy than the other type. So you don't have to stress on what type of filler. Whenever you come in, we discuss your goals. I see filler everywhere now. I see what your lip kind of looks like. What have we injected before in you or anywhere else? And then I pick something that's appropriate for you. Everybody wants something different too. I have some patients that want something soft, flexible, natural, just kind of rejuvenated. I have some people that want a little bit more of a fuller lip. And then I have some older patients that they're like, look, I just don't like these lines. Can you soften these lines? So that's another option that I can do too, more of an anti-aging type lip. So don't stress about the product. Just come in, tell me your concerns, and then we'll come up with a treatment plan and I'll pick the product that's appropriate for you. Another common question I get is, oh my God, Candace, does it hurt? Well, you come 30 minutes early for your appointment and we put a numbing cream on. It's called topical numbing cream. You sit with it for about 30 minutes and then I'll wipe it off. Some patients are totally fine with just that. Other patients, they say, you know, Candace, I still feel it and I don't want to feel it. So then I do a dental block. There's a artery, nerve, and vein in our V2 bundle and our V3 bundle. So I do a little injection right here, here, and here, either from outside or inside the mouth. And I deaden the nerve right here, here, so it deadens all this area. So it makes it a lot more comfortable. The negative is you're pretty numb for about an hour, so it just has to wear off. So I say don't go have a fancy talk or something that you have to give right after. Just kind of leave it be and it's going to wear off. It's going to be fine, but it makes it a lot more tolerable. I also use ice in the treatment. I use vibrating tools and stress balls. So we have 80 different ways. Some patients started using fans too. So I have 80 different ways to make it more tolerable for you. Everybody handles pain differently. So don't stress. I have something that's for everybody. So yes, you can get it. Duration. So I kind of covered that already. How long does it last? I tell all patients up to about a year. Now, if you're coming to me with little bitty lips and you say, hey, I want big full lips, are we going to get that in one appointment? No, that's going to take time. I have to build that slowly to allow the lip to expand. I kind of explain it like You know how when you go through puberty as a female and you go from no boobies to boobies. Some people, you see that they wake up the next morning and they have boobs and they never had boobs before. What happens? They get stretch marks and it just looks terrible, or with pregnancy, sometimes people just gain weight really quick. Some of that's out of our control and stuff, but I'm just trying to give you an analogy. But if we grow that tissue nice and slow, through puberty or in pregnancy, then it allows the tissue time to expand. So then you can have much more natural results. You don't have the negatives like stretch marks. So in the lips, if you come to me with very, very small lips and you say, hey, I want fuller lips, I'm going to tell you, okay, I can get there, but you have to be patient with me and I have to build it slowly over time. So I would do sessions on you about every 2 months and build it gradually. I put the jelly type stuff in and then I allow that tissue to expand. It just takes a while. It does. If I shove it all in all at once, then what's going to happen? You're going to have a lot of swelling, a lot of inflammation, and then eventually it can push it out. So you have an area above your lip and below the lip that we've seen some of these people, poor babies, but the filler gets pushed out. So I don't want that to happen to any of our patients. I want that filler to stay in the lip itself. So if I build you very, very gradually, then that's going to allow it to expand the most natural way possible. So product selections, I kind of already covered that. There's some people come to me asking for a specific type of filler. There used to be a handful. Now there's like 80 handfuls. So what I chose to do was train on every single type of product and feel every product in my hand too. Also inject several patients with every different type. So there's Revance, there's Revinesse, there's Juvederm, and there's Restylane. That's the families. Then in the families, they have products in each one of those. So I pick based off of what the patient presents with, what's their concerns, what's their goals, just what do they want to achieve. Also, what kind of products in there already. Sometimes I say, hey, you got a lot of buildup. Sometimes we have to dissolve before we even get started. So that's the whole point of that consultation, to where I can customize that for you. Downtime. So let's talk about that. It is a needle that I put on these syringes and I'm injecting into the lip. So the negative with that is it can be lumpy, bumpy, bruised, swollen. It takes about 2 weeks to settle. So I always tell patients, I describe it like this. I'm going to inject you today. You're going to love it. And then by the evening, it's going to start bruising. You're going to start seeing some discolorations and it's going to start getting a little puffy. The next day, you're going to wake up and you say, oh my gosh, it's too big. Or you may even swell, and you can swell asymmetrical because you might have a little bit more bruising, which is bleeding under the skin on one side than what you have on the other. So you're going to wake up the next morning and be like, oh my gosh, it's too big. Take it out. It's uneven. I don't like it. That's totally normal. The following day, you're going to be like, oh, okay, maybe she's not crazy. Like, it's starting to look a little bit better. I'm not in love yet, but I'm kind of seeing potential here. By 1 week, you're obsessed. Most of the swelling's down, not all, and most of the bruising's kind of calmed down. Usually patients go buy a new lip gloss, lipstick, something. They're kind of obsessed. By 2 weeks, usually get a message, oh my God, all the swelling's down. I love it, but I want more. I want bigger. When can I book my next one? So close your eyes for 2 weeks. No. Don't love it or hate it for 2 weeks. Let it do its thing. It's a healing process. It just has to go through those phases. So 2 weeks to kind of settle. If we're working on building a lip, then typically about every 2 months, but it's really patient specific. So I'll kind of tell you that. If that's your plan, hey, I want to build a bigger, then just let me know in your consultation and we'll come up with, okay, I want you to see me every X amount. If you're in maintenance and you just like, okay, I like what you've done so far, Candace, I just want to maintain it. About every 10 to 12 months, patients will get another lip treatment to maintain it. Somebody said, I want to be looking natural. I don't want to be ducky. A lot of people do. They don't tell their husbands. Their husbands don't know. Or they tell their husband, hey, I want lip filler. And the husband's like, nope, you're not getting it. So it's not, it's not your significant other's fault. All they see is bad jobs on TV. They don't see some of your friends that have it that look very natural because that's the goal. I always tell patients we never want to look filled. We just want to look rejuvenated and refreshed. Yes, we can add a little bit of volume in the process, but we don't want to be overfilled and giant. We've seen these crazy filters and all that stuff before. So my goal is to always keep you looking natural and always steer you in that direction too. Also, sometimes after getting filler for a while or going to different providers or not choosing the right type of product for your lip, injecting too much at once, injecting in the wrong plane. There's many factors that go into this, but you can have filler migration as well. So if you are a patient or a potential patient and you feel like whenever you do a kissy face like this and you have heaviness all right here, it's like kind of bally right there, or underneath the lip right here too, it's a little heavy, or if you don't like the shape of your lips or the consistency and you have had filler before, let me know. We can do something called injecting hyaluronics, which is an enzyme into that area, and that'll flatten it out. It's like a little Pac-Man that kind of eats the filler, so it dissolves it and melts it. So if you have migration above the lip, we can flatten it back out. If you have migration below the lip, I can flatten it out. If you flip your lip like this is getting real up close and personal, but if you flip your lip and you have little balls underneath, usually they kind of look like a blister would look, but it's not a blister. That is superficial filler that your lip just pushed out. So if that happens too, I can dissolve that as well. So there's a lot that goes into lip filler besides just, I want lip filler. No, we gotta assess. We gotta kind of come up with some of those things, come up with a customized plan for you. Another question that I get too is lip flip. So lip flip versus lip filler. Oh, the famous question. So what does that mean? Lip flip, people think, that I'm going to just try that out to see if I like it, to see if I want lip filler. Wrong. Totally different. So lip flip is with Botox, Dysport, or Jeuveau. It is a neurotoxin that you inject to help soften the muscle. So what does that mean? Whenever you do a kissy face like this is your orbicularis oris muscle. It's a sphincter muscle that contracts like this. So if this muscle is contracting too much, it's going to suck that upper lip under. So whenever you smile, it's kind of hard to do, but whenever you smile, it's going to do like this. So sometimes patients will say, Candace, I have a lip, but I can't see it because when I smile, it gets sucked under. Oh my gosh, my faces. So what do? I do a lip flip on those patients, and I inject some Botox, Dysport, or Jeuveau above that upper lip. And whenever you smile, it doesn't get sucked under. It rotates it back out to where you can actually see it. Another issue is a gummy smile. So when you smile, sometimes I have patients that, I can't force myself to do it, but they smile and you can see your gums at the top. So what does that mean? You have an L-sand muscle right here. It's on the corners of the nose. So if that muscle's super, super strong, it's going to pull up the lip too much. So when you smile, you see all your gums. So some people, they love it. It looks beautiful, perfect, keep it. Some people, they're like, it drives me crazy, or it pulls on one side stronger than the other. So every time they smile, they have like a heightened smile on one side. This is so hard to force myself to do. But I can inject Botox, Dysport, or Jeuveau at the corners of the nose in that L-sand muscle. So that's going to relax that gummy smile down, that muscle that causes it to pull up. So whenever you smile, it won't be heightened and it won't be flipped under. So that, if we decide to do that, that's a lip flip appointment that you book. That is $100 flat fee. And that helps with all those issues. Now, if you want more volume, if you want to shape the lip, if you want to add structure to the borders, if you have vertical lip lines, if you have an M-shaped lip where it's full in the middle and hollow in the outsides, and you want to work on that, that is lip filler. So lip filler versus lip flip, not the same thing. Do some people present to me with both problems? Absolutely. Do sometimes I do both of them on the same day? Absolutely. Because you have to pick the right, whatever the problem is, you have to pick the right solution. You can't just pick a lip flip to solve a volume issue if that's not the problem. I hope that makes sense to y'all. Also, I always tell the patient too, some people come to me and they want lip filler, but the facial structures, my job is to assess you as a whole, and to assess right now, you may not have lips, but you're asking for a lip filler. So I need to see, how does that balance on the face? Do you have the chin structure to support it? Do you have the cheeks to support it? Some people come to me with very, very weak features, or they lost 100 pounds, and they have no more fat left in their face, and they're like, I want lips. Well, if I do something like that, obviously that's a dramatic description, but you get what I'm kind of the picture I'm painting. If you come to me and you ask for that, I'm going to say, well, I think we need to take a step back first, and I think we need to balance the facial features to keep you looking natural. You need to support it. If not, then the lips are super, super prominent in the face and everything else kind of blends in. You don't want any specific focal point of the face to be massive and huge. Some people, they have a really prominent cheek. Some people have really prominent lips, but in general, we want to balance that. So I might recommend, you might come for lip filler and I might say, hey, I think we need a little bit of chin support. I think we need a little bit of marionette lines where we have in those shadows. I think you're starting to have some nasal labial folds. I think I need to support you in your piriform aperture. So there's a lot to it. So come to me with an open mind if you say you want filler. And then I say, hey, we might need to address a couple other things as well. Remember, my goal is to keep you looking natural and to keep all of your facial features very balanced. I'll never overfill anybody. That's my one promise that I promise to do. Also keep you safe as well. Pricing. So let's cover that. My lip filler pricing is $700. It is a flat fee. So that is my lip fee. It doesn't matter if we do 1 drop or 80 drops. You're paying for the service itself. If you decide to add on the lip flip, if we feel like that's your problem and that's what you'd like, I shouldn't say problem, but thing that we want to enhance, then it's $100 for that. So you can do either or you can do both depending. So I think that about sums it up. This is lip filler. All filler lasts roughly about a year. We can inject that in your lips. If you book an appointment, let's say for 9 o'clock, you come 30 minutes before, you sit with numbing, and then we'll customize a treatment plan for you and then inject in that same day. We can also do those dental blocks to help deaden it, make you super, super comfortable. We give you those aftercare instructions to go home with. That's something I forgot to mention. We give you a little chapstick. We say just that for the next 24 hours. Why? Because I poke you a bunch of times. That's an opportunity for bacteria to get in there. So I want to keep you clean. The whole entire time I'm injecting, I'm constantly disinfecting with hypochlorous acid to make sure you don't get an infection. So I don't want you to get one at home. So I give you that new chapstick. You keep those lips hydrated with that. I say no extra ice, no extra massage when you go home. Everything that needs to be done is going to be done before you leave. I take the time to sit there and mold and sculpt the lips. So I don't want you to go home mashing on ice or massaging it and then you're massaging it out. I just spent all that time making it perfect. I want it to stay exactly like that. Before you leave it, make sure it's perfect. If anybody's ever, give me a hands up if I've ever injected your lips before. And I look at you in all kind of crazy upside down views to make sure everything's perfect, to make sure we're all in agreement before we leave. Also, a goal too, a lot of people come to me very, very nervous. I try to put myself in your shoes and make you feel comfortable the whole entire time. So I do let you see halfway through the treatment. I give you that mirror. I make sure we're on the same page because your version of natural, my version of natural might be 2 different versions. So I try to eliminate all that before, but just in case, we're on different pages, no big deal. Here's a mirror. I'm like, tell me what you see. Is this good? Do you like this? And then most of the time patients, I feel them take a deep breath and they're like, oh, okay, yes, this is what I was doing. And then I inject the other side and they do much, much better once I show them that. And it just kind of eases their heart a little bit. And then, of course, right before I do my final touches, I let them see. And then at the end, I let them see too. And then we always take those after pictures, make your collages and all that good stuff so you can see. And that's the funnest part of this because patients are like, I love it. It's so awesome. Okay, so we've been having a lot of people let us share before and afters. I'm having so many Google reviews lately, so many word of mouth referrals. We're getting, about 150 new patients a month plus. I don't know. I can't even keep up anymore. It's crazy. So I'm asking all these people, I'm like, how did you hear about us? And a lot of times it's actually word of mouth. So we just wanted to say thank you very much. If we have any patient that comes into the office and they're telling us so-and-so recommended me or whatever, I'm putting all y'all names in this little bucket just because I think it's something nice to do. And I'm not emptying the bucket. I'm just kind of adding to it. And we're pulling randomly every now and then for winners just to say thank you for being nice. Because, you don't have to tell your friends that you were happy over here. You don't have to help out other people. And it's nice that y'all sharing and letting us, spread the word and helping us grow. So hold for 2 winners. So I'm going to announce who's these 2 winners. And then in their wallet, so We do have the VIP programs now. So VIP program, because I'm getting a lot of messages, it looks like, on here about it. That is $100 a month, but the full amount goes to your wallet to where you can use it on anything at all that you want in the clinic. So let's say you're a Botox patient and you spend $400 on Botox and you come every 4 months. If you don't want to fork out $400 at your appointment, then you become a VIP member. Every month, it's going to come out as $100, and then you're going to stack it in your wallet with us. So basically your account, like a store credit at a store or something like that. So it's all stacked in your account, and then you'll have like $400 saved up for your Botox. You come for your Botox appointment, and it's free. It's just a way that you can kind of pre-save for it. Whenever I was growing up, my parents had a Christmas club fund, and it was kind of the same principle. I don't even know if they do that anymore, but every one of my dad's paychecks, they would put a little bit of money aside, so whenever it came time to Christmas time, it wasn't that big of a deal forking out all this extra money. So same premise, just with funner things, you know, Botox, you know, whatever. No, I'm picking on Botox, but you can use it on whatever you want. So $100 a month comes out, but then you get access to all of our VIP stuff. So all of our promotions or special events, any kind of just fun thing that we do, most of it from this point forward is going to be for VIP members only. Also, the stimulator glows, radical stimulator glow and regular stimulator glow is 20% off all the time for you. That's a very popular treatment that doesn't have any downtime, so that's a good one for you as well. And then for your birthday month, you'll get all kind of extra stuff for 20% off, like your wellness labs, an IV, 3 full-size GSR products, so like your Zeo Gentle Cleanser, exfoliating polish, and complexion pads. Full sizes, you'll get those 20% off. One more thing you get 20% off too. I forgot. I don't have the paper right here. But the point is, for your birthday month, you get extra little hookups. So if that's something you want to do, if you click the link in our bio, I have a link to the patient portal, and you can log into your patient portal and you can sign up on there. Let's say you're in the office and you're getting, I don't know, filler, and it's $700 and that's your total. You can sign up for a VIP member right before you pay $100, but then you use that for your filler appointment the same day, so you're not paying any extra money. It's literally, it's straight going back to you. Okay, so I'm going to stop talking now, and I'm going to announce our 2 winners. So 2 winners that we pull, Amy Zanos and Robbie Scheck-Snyder. So thank you very much, Amy and Robbie, for letting us share your before and after pictures. We appreciate it, and we just wanted to give back to y'all. Yay! So we'll tag y'all in the comments. I am going to add right now to y'all wallet a little gift card, so y'all can use that at your next appointments. So thanks very much, guys. If you have any other lip filler, lip flip, VIP, I don't know, covered 8,000 things on this live, just put the question in the comments, and then we'll message back. So have a good day, everyone. Happy Valentine's Day. And yes, have a good day. Bye-bye.